Hello friends, welcome back to an educative content. So today we'll be talking about cancer. There is a lot of theories which runs around it, and there is a lot of confusion which runs around it. So I try to give you a very minimalistic approach in how to understand cancer and what are the other alternative measures which you can take apart from the standalone allopathic practice. So all you know is cancer. Must have heard about radiotherapy or chemotherapy. Apart from radiation and chemicals, can alternative medicine such as Ayurveda, naturopathy and yoga can also lead to a better health and management of cancer is what we'll be looking around. So today, being a longer video, I have cut this into two. So the part one is where we'll be talking about what exactly is cancer, why it happens and how it happens. So moving on with this, first of all, let's try to understand what exactly is cancer. Cancer is nothing but the cells which is there in your body multiplies without any control. It's like the cells are what we specifically call it as proliferation. So cells multiply without having any control. This multiplication can happen of various reasons like diet, like radiation, like smoking or anything. So this proliferation, if the body sees this at normal and it doesn't affect or if it doesn't attack these extra amount of proliferation which is happening in your body, that is what we call as cancer. So it is not like it happens overnight. There are certain, as I have said before, there is a lot of internal environment and external environment, and these two influences cancer cells. And it is not even right to say that cancers develop overnight. There is cancer cells in me, there is cancer cells in you, but if your body is tight on its grip and it's trying to take care of your body, immunity, if it is good, and obviously you can see that your response towards cancer is much well handled. So yes, it is not that it happens overnight, it is there in the body. Its cancer cells are always present. It might change because of the food what you eat, because of the environmental situations what you are, and also your lifestyle. So how do they happen and what are this type is what we are trying to look into. So there are two things which you need to understand before getting into depth of it. One is benign. So benign is basically it just proliferates over the surface rather than moving around the body. So let's say a cancer cell on the skin, it just keeps growing there without much distracting the other cells in the body. So they are basically, we call it as benign. Similarly, malignant, 90% of the cases happen within the body, like that of the lungs, that of the stomach, and these can travel across the body because of the bloodstream. They jump the normal surface of the tissue, get into the bloodstream and move across the blood, lodge wherever there is a lot of nutrition available and then grow in that area. So you must have heard about lung cancer being developed in the stomach or stomach cancer being developed in the lungs. Or you can see the gallbladders cancers in the intestine because the periphery or the surrounding areas are very nearby. So along with that, there is something which you need to understand is what we call as carcinoma. Carcinomas what with the cells which is seen on the surface of a tissue, surface of the skin, underneath the skin, surface of the skin, at the same time on any of the lining of the cells. Second is sarcoma, which is basically happens in the connective tissue like that of bones, like that of joints and that of arteries that blood flows across. Then we have melanoma, which is specifically on the skin surface, that upper region of upper part of the skin. You must have noticed some kind of a blemish colors. There's a discoloration between the regular skin color and the cancerous skin color. Not every mole is a cancer, not every dot on your skin is a cancer, but you need to understand that the circular region or the dot or the mole, if it is integrating or it is becoming larger day by day, then you might need to check or consult your skin specialist. So similarly, there is something called as lipoma. These are the fatty cancer cells which is being developed underneath your skin, underneath the adipose tissues, and these are basically not harmful, but at the same time they might lead to restricted muscle movements because it is just above your skin and just above your muscles and below the skin. So it develops and that restricts the movement of your muscles as such. Then we have one thing which is very deadly, which is basically seen in early ages of development, that is leukemia, that is blood cancer, which affects the blood cells and it can lead to a lot of loss in white blood cells, which is the primary factor for you to keep your immunity up or keep your body's protection mechanism up. So these are the 5 different types of cancers which are available or which are there in the body. But only thing is you need to understand what exactly happens and why it is actually happening. So as you see the trends, cancers are generally affecting the males population more than the female population, and coming up to the ages of these nowadays people are more aware of these things, and the cases of cancers have also been slowly coming down because people are more aware of this. At the same time, the medical intervention has taken a long step since the past few years. But in India, you need to understand that every region has its own diversity in cancers as well. So you can see that in southern India, it's basically because of the food what we eat, too much of rice and too much of spices, we develop more of stomach cancer. Or also you can see that meat and alcohol consumption is also very high when you come to the southern states, and that is the reason why you're also prone to liver cancer. Majority of the female counterpart as such have breast cancer and cervical cancer because one is very much we can consider as hygiene. Second, for male, it's basically either mouth ulcers or mouth cancers or lung cancers, which is again a lifestyle problem in men. So very rarely we can see some kind of a mutation of the virus which can lead to cancers, but majority of them are generally because of our wrong lifestyle habits like smoking, like tobacco consumption and other things. But basically when it comes to women, it's 90% of the time it's always because of poor genital hygiene or unprotected sexual activities or any other reason, which is basically because of not taking care of their body or not trying to see the changes in their body as such. So you need to understand these 4 rules before you rule out cancers. One such is there is a cell growth. This cell growth is not checked by the body, and that doesn't lead to the cell death. Because of this no cell death, this division of cells are more, and that leads to increase in the circulation, because now the blood seems to supply more nutrition to these cells because the immunity never said, or the immune cells never said that there was a problem with the body. So the artery or the blood just moves across the system, and then it includes the cells also as its own cells, and that leads to proliferation, and that more in number invades the tissue of the cell. So to be more precise about what exactly it is, I'll give you something like pathophysiology. But before that, we need to understand where exactly is this coming from. So as you can see, the key factor for your cancer, majority of it is because of your diet. People eat either too much of spice, too much of salt. People eat either too much of sugar. They don't have control. A lot of unsaturated fatty acids or fat as such. Along with that, you have, for as I said, in men, it is basically because of the tobacco consumption. There is very minimum amount of cases which we see in radiation, that is because of an external factor. We can also see 7% of it is attributed because of something like viruses, which is not under our control. But majority of that, as you see, 35 to 45%, and more than 50% of the chances are basically because of our lifestyle. So majority of the cancers today is because of our wrong way of eating foods, wrong lifestyle. So even I can consider cancer as something which is very much close to us, because we deal, our yoga naturopathy deals with majority of the non-causative like diabetes and hypertension, which is a lifestyle disorder. Similarly, cancer is also one such of a lifestyle disorder. So coming on to the pathophysiology. So as I was telling, let's consider a simple technique like, or simple cause like radiation. Though it is 1%, what exactly happens is, because of this radiation, the cell in this cell, the genetics changes. Because of this radiation, the gene expression changes. Because of the gene expression changes, the entire cell goes under multiple proliferation or multiple growth. When there is a multiple growth because of this gene, which is not being considered as bad for the body, then slowly these cells starts to grow without any much of a trouble in the vicinity, as there is no much of a white blood cells which is saying that it is wrong. Slowly these get something called as circulation. So because there's a lot of demand of energy, lot of demand of nutrition, the blood vessels, what we generally call as osmosis. So basically the blood vessels come and try to give or feed this cells more. Once they feed more, then they again increase their population or increase their membrane. This leads to a pressure on that local site, which we basically called as carcinoma in situ or cancer in situ, where there's a pressure which is being built up on the surfaces of these cells, and that leads to, I will explain why this carcinoma in situ is a very important thing later. So before, as soon as the carcinoma is or any kind of a cancer is basically more strengthful at the surface, then this in situ is where it breaks open the normal membrane and moves inside into the blood vessels. Once it gets inside the blood vessels, and then obviously it's a free ride for wherever it wants, and then it lodges wherever the nutrition is available in more, and then slowly it divides there. So the reason why I said carcinoma in situ is very important is, if you could notice any cancer at carcinoma in situ, that is the second or third stage of it, then majority of your allopathic, non-allopathic, alternative medicine will work. Once it gets inside the membrane, once it gets within and it is not being detected by the body, then it can go anywhere, and we don't have much answers when it goes into the bloodstream and then just gets into the every system of it. So that is the reason why cancers, if you see some changes in your body, you need to get yourself tested just to make sure that they doesn't get out of control. So to control it, it's what we basically need to understand as cancer in situ. So make sure that you get this word right. Carcinoma in situ is one such thing where the blood cells or the cancer cells are just getting into the bloodstream. So how do you diagnose this? So there are three phases of it. The first phase is where we try to screen what exactly is the problem. So it includes all your blood tests, all your x-rays, and also if it is inside the body, let's say it's the intestine, we'll go for endoscopy or colonoscopy to try to understand what exactly is the extent of it or what exactly is the problem. Then let's say there was some chemical changes, there are some x-ray reports which say that something is wrong, then we go for tissue diagnosis and trying to understand what is the extent of this growth. So not, as I said, not every growth or every changes in your blood chemistry is cancer. So we need to go through something called as biopsy, which tells that what exactly has been the proliferation or how the cells has been proliferating. So that is basically we grade it accordingly. So as I said, carcinoma in situ is where we can see whether there is a active blood communication between the cell and between the blood cell. So if there is an active communication, then we grade it as a higher degree of risk rather than contributing it through any other medication. Because of this, there is a lot of other molecular changes within the system which we can know through tissue biopsy and trying to understand what exactly is the local picture of that location. Because of this, once there is a cancer, once you try to understand this, then the evaluation and prognosis started. So basically, this is also considered as one of the major steps in cancer diagnosis and management, because as soon as I say somebody is having a cancer, that itself puts him down. So that leads to depression, that leads to stress, that leads to anxiety, that leads to a lot of physiological and psychological changes. Because of this physiological and psychological changes, there is a way the body responds to it. So if you don't understand that cancer is going to be not a big deadly disease, but it needs a little bit of more confirmed or more sophisticated, or let's say not even sophisticated, more trained or scoped treatment, then only you will try to understand. So there you have to re-educate yourself on what exactly is cancer and how it is actually having a lot of things. So this is a part of diagnosis, because if you lose yourself here, once you hear the news of cancer, then slowly everything else will be not of much use, because you have already lost the battle before even getting into the field or getting into the war. So that is the reason why physiologically also and psychologically also we need to make sure that you are prepared to take on the challenge by giving you a lot of medications, or at least by telling you and talking to you regarding this, what exactly is happening in the field. So this is what is all about cancer. I hope you understood the basic amount of, though it's a large or a vast subject, I just wanted to give you a gist about what exactly it is and what all the things which is available. and what are the interventions and what will be the yogic intervention is what we're focusing on the next coming week. So if you like this, a small session on what exactly we were trying to cover on cancer, please hit the like button, share this among your friends, and make sure that you subscribe for this channel for coming up on the next treatment approach, which is very specific, not just on the radiation and chemotherapy, but also on how yoga, naturopathy and Ayurveda make sense to this treatment of cancer as such. So I'm not just talking about how allopathic and naturopathy together, how it can work. Also, I'll be trying to talk you through what are the ways in which alternative medicine as such can have a lot of impact. Okay, so make sure to stay tuned for this channel. For the next coming week, we'll be talking about the treatment approaches and treatment for cancer. Till then, stay safe, stay fit. Thank you.